morning, everyone, and welcome to Stanislaus State Science Week. My name is Sunpreet Kaur.
And my name is Chelsea Flores. We're part of the Science in Our Community team here at Stan State.
Stanislaus State is pleased to provide the community with opportunities to learn by engaging in live activities and pre-recorded activities throughout this week via Zoom and on Science in Our Community YouTube channel.
Before we start, please note that this event is being recorded, and we'd also like to ask you to stay muted unless you're called upon. Additionally, to keep this activity fun for all, please only use the chat to ask or answer any questions unless stated by our presenter. Thank you.
And now it's my pleasure to introduce our activity, Nursing Simulation Lab, with Dr. Matthews and Ms. Peltier.
Hi, I'm Wendy Matthew. I'm the Simulation Program Director for the School of Nursing. Thank you for being here with us today. We're excited to show you our simulation lab. So let me just define simulation for you. So simulation is an environment that we can create for our students to be able to practice as nurses. So they get to use mannequins and they get to be the nurse for the day, and they get to do all of the things that they would do in the hospital setting as a nurse. So of course, we don't want them practicing on humans, right? Because if they're practicing on a human, they can hurt them. But in the simulation lab, they're able to do everything that they would do in a hospital setting. And we as the nursing faculty can show them the things that they're doing well, maybe the things that we can help them with to get a little bit better. So let me just show you around our lab. This is our mannequin. Our mannequin can do everything a human can do. She can cry, she can blink, she can sweat, she can bleed. So if we put an IV in her arm, she'll have a little bit of blood there, just like a human would. She can make urine, so she can go pee, she can poop. We can hear her heart sounds, her bowel sounds, her lung sounds. She can talk to us. We can give her medications. As you can see here, we have some blood hanging for her. We can see how she's doing on the monitor here. So this monitor will show us how is her heartbeat, how is her blood pressure. If we do something to her, such as put this oxygen on, and I turn the oxygen on here, she will actually respond. So when I look at the monitor as a nursing student, I can say, oh, that helped, or oh, that did not help very well. And I can keep doing things and practicing with her to get better and better. So when I'm in the hospital setting, I'll do a really good job as a nurse. This here is where the faculty can use it almost like an iPhone or an iPad, and we can make this mannequin do what we want it to do. So like I was saying, if a student came in and said, oh no, her oxygen needs to go up, I can make the oxygen go up on here and then it will go up on her. So it's really neat that the students can do everything in here that they would do in a hospital. All of our items work, so they can get oxygen, they can use suction, they can call the doctor or call a nurse or phone a friend, right? I don't know what I'm doing, please come and help me. They also have all the supplies like they would in a hospital setting. So anything that they come in here to do and take care of the patient with is already in the room. These mannequins also have chest rise and chest fall, and they blink. So when students come in and they're taking care of these patients, they actually really feel like it's a human being. They can move the mannequins over. Basically, the only thing this guy can't do is get up and walk. Everything else this mannequin can do. So let me show you some of our other rooms. Students come into our program, really, they don't know a whole lot about nursing, right? So we start with very basic things. How do you listen to a heart sounds? How do you listen to bowel sounds? How do you take vital signs? Those are very basic nursing skills, but as they go through our program, which is 3 years long, they learn more and more, okay? So when they get into the third semester, they will take care of a mom and her baby. And so in this room, they have a mom, and this mom is, when they come in, sometimes pregnant, she can actually give birth. And then after the mama gives birth, the students can take care of mom and baby. And then they can learn how to take care of old people, young people, pregnant people, and all kinds of different things like heart problems, lung problems, pneumonia, asthma. And so with that being said, I'm going to turn this over to Jennifer, who's going to be our nursing student for the day. And she's going to show you what it would be like to take care of a pediatric patient. So what would happen first is, this is Jennifer.
Hi everyone, my name is Jen and I actually am faculty here, but I'm going to show you what students do when they're taking care of a patient within our sim lab. So the most important thing that they're always going to do as soon as they walk in the room, they're going to do hand hygiene so that they have nice clean hands. Either wash their hands or use the sanitizer. And then we always want to put gloves because we don't want to touch a patient that might have blood on them or some kind of gooey thing, especially because of COVID. We want to really make sure that we're protecting ourselves from the germs that the patient has and also protecting our patients from the germs that we have, because we have germs on our body just like everyone else. So first thing you're going to do is always put gloves on when you're taking care. And hopefully when you're at the doctor or if you go in to see someone at the hospital, any nurse puts gloves on. So we'll do hand hygiene and put our gloves on.
So as Jennifer's faculty member, I would tell her what's going on with this patient. So we're going to see this little guy here. His name is Johnny. He came in because he has a history of asthma. So he has a hard time breathing, and the asthma actually led to some pneumonia. So now he's been with us for quite a while. He's better. He's ready to go home. And now Jennifer is taking care of him and making sure that he's all set to go home and ready for vaccinations and medication education.
So, hi, Johnny. My name is Jen. I'm going to be the nurse taking care of you. I saw that your doctor already came in and your doctor said that you get to go home. So before I can send you home, I just need to make sure that everything within you is nice and normal. So I'm going to do your set of vitals, and vital signs consist of getting a blood pressure, listening to the heart, and also a temperature. So I put the blood pressure cuff on my patient. And then I'm going to go over to the monitor. And this one, just like we said, we can go ahead and start it.
Does it start? There you go.
So do you see how this machine is making a sound? It's mimicking like it's doing the blood pressure like we would do at the hospital. I also now, while that's doing the blood pressure, I'm going to take Johnny's temperature because we want to make sure Johnny's not sick. So we have the same kind of tools that we have at the hospital. So under your tongue, Johnny. And then as soon as this the thermometer goes off, I'll get whatever the patient's temperature over here on this monitor. So he's nice and normal. The blood pressure is normal. I can look at his heart rate, which looks normal. So now I want to listen to his heart and his lungs, because remember, he came in because he was having a difficult time breathing. So I'm going to grab the stethoscope, and my teacher has already plugged in a heart rate. And so I can, when I put my stethoscope on, I actually can hear what the heart and his lungs are sounding like. So I can hear him breathing. So I'm going to go ahead and just listen to his chest and his other lung, because you have two lungs. So we want to make sure we listen to both. And you have little lower areas for it. And his lungs sound nice and normal because my teacher had already put in what the sound should. Now I'm going to listen to his heart. And this heart rate that I'm listening to is the same as the heart rate over here on this monitor. And it's nice and normal. The next thing I'm going to do is I'm going to listen to his tummy to see if I can hear his lunch gurgling in there. And I want to listen to it a couple different places. When I'm doing this, I have touched his skin so I can see if his skin is nice and dry or if it's wet. We normally have nice, dry, warm skin, and he feels that way also. So now that I've done his vitals and I know that he's safe and everything looks normal, I'm going to teach him how to use his inhaler. So Johnny, we're going to send you home with an inhaler and the spacer. So you're going to take the cap off, put the inhaler in. And when you go ahead and take a deep breath, we're going to put this on your mouth, take a big breath in, perfect. And I just gave him some medicine. So we have the same things here in our sim lab that our students are going to see when they're in the hospital, so they can practice teaching our patients also. So this is an inhaler and then the spacer. So Johnny's ready to go home. And before he goes home, he has to get his vaccinations because he's not up to date on his flu vaccination. And that's what got him sick. So I'm going to go ahead and go to the other side of the bed, and I'm going to give Johnny an injection or a shot. So every time that you get a shot, people like Band-Aids, right? So I'm gonna pull a Band-Aid out. I have a syringe here, and this is what I'm gonna draw the medicine up in. So these are all the things that our students get to practice with. I'm also going to put the needle on. Get it all ready. I'm gonna have to pull medicine out of this container. So this container has a little rubber stopper on the top. And if I put the needle that I was gonna stick Johnny with in here, it's not gonna be as sharp. And I want the needle to be nice and sharp for Johnny. So I'm gonna use what's called a blunt needle to pull this medicine up. So here in our sim lab, we're able to have our students practice giving shots. So I'm gonna take my lid off, and this is called a blunt needle. As you can see, it's not really sharp. So if I was to touch it, I wouldn't be able to poke myself. I'm gonna put it into my medicine vial, and I'm gonna pull up some medicine. And then, so all my medicine is now in this syringe. So I'm gonna pull down so all the medicine gets in it. And I'm gonna put the lid on this blunt needle. And because I don't want anyone to get stuck, I'm gonna take this blunt needle and put it in my sharp container. And put it up, so all of the sharps, just like at the hospital, so that no one can get access to that needle and get stuck by it. It's now time for me to put the needle that I'm gonna have to stick Johnny with on the syringe and push out all the air that's in there. And then every time we give an injection, we want to clean the arm or the place that we're gonna give the injection. So kids normally will get a shot in their arm, which, as you can see, our mannequin has this little circle here, which is for us to give an injection. Also, sometimes some kids will give a shot in their leg, but Johnny's all good and he's old enough, and I have a small volume. So I'm gonna take my alcohol swab, which doesn't hurt. It just makes the skin nice and cold, and it cleans it. So I'm gonna take Johnny's arm and I'm gonna clean it. And I'm gonna let that alcohol dry just a bit, because when it dries, that way if my needle goes in, it doesn't sting Johnny. While I'm waiting for that to dry, I'm gonna get my Band-Aid ready, so that as soon as I'm done and I pull this needle out, I'm gonna put the Band-Aid right on Johnny. So Johnny will so that Johnny can see that he has where he got his shot. The alcohol has dried because it doesn't look wet. And now I'm gonna take the needle lid off. And as you can see, this one is much sharper. And that's what we want if we're gonna have to stick into the skin, because the sharper the needle, the less it hurts the patient. So I'm gonna hold Johnny's arm and I'm gonna tell Johnny, I'm gonna give you a quick little injection. It's gonna hurt a little bit, but as soon as I'm done, you'll have some of your vaccinations, which will help you so that you don't get as sick. So into his arm I go. I'm gonna push the medicine in. And as I'm taking this needle out, I put this lid on the top of it so that I can't get stuck. I'm then gonna put a Band-Aid right on Johnny's arm so that Johnny knew where he had got his shot. And then I'm gonna go and make sure that Johnny's mom knows that he's all ready to go home. Johnny can change into his own clothes, and then we'll take him out of here in a wheelchair if we were in the hospital. So as a student, I was able to give an injection. I got to listen to the lungs. I got to teach my patient on medications. I got to do vital signs. And this is just one room in which our simulations, this is just one of the various different types of simulations we can do.
Thank you, Jen. All right, so now we're going to open it up for questions. Do you have questions for us?
What happens if the power goes out?
All of our hospitals, as well as our simulation lab, has backup generators. So a lot of the equipment that we use is life-sustaining, meaning that we cannot lose the power or those machines will stop. So we have generators that will help until we can get it fixed.
Okay, so the next question we have is, what happens if you inject the mannequin too much medicine?
Answer?
So when we're injecting the medicine, that's why we always double check that we have the right medicine and the right amount. That's one of the things that our students learn in nursing school, that they're giving the correct patient, the correct medicine in the correct place and the correct amount. On our mannequins, they have a reservoir behind that circle that will hold all the medicine. So multiple students can come in here and give injections. But that's one of the things as a nurse that you need to make sure you're giving the correct amount. I hope that answered your question.
Thank you,
The other
Jenny.
thing, go, sorry. So the other thing is that with pediatric patients, their medications are double checked. So if one nurse thinks she's right, she still goes and checks with another nurse to make sure she truly is right. So there's a lot of safety checks in place to make sure we are giving the right medications.
Thank you. So our next question is, the students are wondering what the cost of each of the mannequins is.
Great question. What do you think it is? What would you think it is, Sanpreet?
I would say somewhere in the thousands, maybe. I don't.
It is, yes. So our mannequin, the first mannequin I showed you, she's $70,000. And then if you buy the warranty with her, which so that means if she breaks down, we can send her back and they can fix her. That's another $10,000. So she costs about $80,000. So as you can imagine, we are very careful with these mannequins, and they are locked up with so nobody can get to them without faculty being here.
The next question is, when the mannequin has a baby, are you able to put the baby back into the mannequin?
Yes, so actually I teach OB, and during the course of having students in here, we might have that mannequin deliver 20 times. So we can put the baby in different directions, having its feet come out first or having its head come out. But all of these mannequins are able to repeat whatever the skill was. So we want to make sure that every student has an opportunity to practice doing deliveries and seeing deliveries. So yes, we can put the baby back into the mom. It only takes about 30 seconds, reset the computer, and the computer delivers it. So the computer pushes the baby out. And so that the students can practice doing the deliveries or watching their instructor do a delivery. Great question.
The next question is, how can you determine if the shot was given correctly?
Because the faculty is watching to make sure. So if I was watching Jen as Jen's faculty, I would make sure that Jen unclipped her needle appropriately, that she was being safe, that she cleaned the skin before, that she educated the patient, that she checked all the rights of medication administration, which is the right patient, the right dose, the right route. And the other thing is that I'll turn my camera around and I'll show you where we sit as faculty. So right here is a computer, and in the room we were just in, I can see Jen, but Jen cannot see me. So it's a one-way mirror. And so I'm actually over here watching what Jen's doing. I can control the mannequin from here, and there's Jen as my student doing the items that we were talking about. So we can actually watch her as faculty and make sure that she did everything right. Now, let's just say, for instance, Jen made a mistake. That's okay. It's okay that Jen made a mistake, because as her faculty, I'll say, hey, Jen, you didn't clean the patient's arm before you stuck the patient. What can that cause? What are you concerned about? What can you do better next time? Right? And we just use it for a place to learn. We don't say, oh, Jen, you're going to be a bad nurse. No, we're going to say, hey, Jen, how can you be a better nurse? Right? And so, having mistakes in simulation happens often, and that's okay, because that's how we learn. Good question.
So their question is, what happens if you do not get all the air out of the syringe?
So on TV, it always shows you that they will kill the patient on TV because there's air in the syringe. That actually isn't something that really hurts people. It's what TV has made people really scared of, especially with like IVs. So the goal of a nurse is, of course, to push up on that syringe so all the air comes out the top of the needle. So the patient's only getting the medicine. But if a little bubble goes in them, it's not going to hurt them. Great question.
Thank you. So there's some students who are wondering if the mannequins can talk.
Yes. I don't know if you said talk or cough, but they can do both. We can actually talk for them as faculty. So there's a little microphone and speaker in their head. And on the side that I just showed you in front of the computer, I can speak as the mannequin for things that are more that I want to explain more, but simple yes and no questions, the mannequin can just say themselves.
And the next question we have is, how many different simulators do you have?
Oh, probably over 20. So we have several babies, like brand new babies and then toddlers. We also have a 6-year-old, 2 6-year-olds, a bunch of female adults, 2 male adults, a couple mannequins that give birth. We have quite a lot, and we also have over 20 hospital beds. So this lab that we showed you today is only one of the labs. We have 3 others, as well as a community health department. It looks just like a home, and we can mimic home visits in that apartment.
Thank you. So our next question is, from the mannequin, how can you tell if they have diabetes or asthma?
So when your patients come to the hospital, they have many signs, right? So if a patient says, I can't breathe, when Jen listened to the lungs, Jen would have been able to hear wheezing, and that would tell her that the lungs are constricted, right? So when we breathe and we take a deep breath, you don't hear anything. But if you have asthma and everything's tight, you're going to hear wheezing because it's hard for the air to get through those little tiny airways. With diabetes, we would check their blood sugar. So we actually have these little fingertips that you can put fake blood in, and the students can take blood sugar and see that the blood sugar of the patient is high or low. So everything here, just like in the hospital, you have to assess your patient. And sometimes the students don't know why the patient's here. So they have to do assessments to figure it out.
So the next question is, can the mannequins die during a sim?
That's a really great question. So of course the mannequins can die, but as a teacher, unless the script was to say that the mannequin dies, we wouldn't want them to die, because that's really scary for students, especially while they're trying to learn. So if a student is doing all these things that are wrong, that would actually make a patient die, we would stop the simulation and we would come in and talk with the patient or the student about the things that were going wrong so that they could fix it. And then we would rerun the simulation. Now, sometimes we do have simulations for our students that are about ready to graduate where they actually have to do CPR. And sometimes that scenario or that play is for the mannequin to die. But all of the students know that the mannequins are supposed to die in that role that they're playing. When we're doing CPR, like chest compressions. Otherwise, we wouldn't want the mannequins to die because it's too scary for a student who's trying to learn the craft of nursing.
So the next question is, do the mannequins ever glitch? If they can cry, can they scream?
Most definitely. So when we practice doing deliveries, there's voice that's recorded, and we hit the button on that sim pad and the mom can moan, she can scream, she can say, I can't. We have different sounds of screaming. We also have sounds of babies crying. So we get all of those sounds are pre-programmed into our mannequins on that little pad that Wendy showed you in the first room.
Thank you. That's really
As far as glitching, yes, our mannequins glitch all the time. As you guys can imagine, they work perfectly until I have all the students in front of them and then they decide not to work. When that happens, we just fly. It's almost like being on the fly or running with it or just doing what we can. So if we really can't get the mannequin to start again, we'll just tell the students, this is what you're seeing or this is what you're hearing. So if our mannequin wasn't working and Jen said, hey, Wendy, I cannot hear lung sounds, I would tell her, okay, the lung sounds are clear. So it's not ideal, but we just work with it because, technology sometimes can be tricky.
The next question is, when the patient is discharged, what's the reason for taking them out in a wheelchair?
Most of our hospitals want the patients to go out in a wheelchair because they don't want them to fall, because if they fall, they could get injured. And we already have wheelchairs available. The reason we have our nursing students is because it's another skill they can practice. They can practice getting the mannequin out of the bed, moving the mannequin over to the wheelchair, and pushing the wheelchair. So we also have canes here, and we have crutches, and we have walkers. And part of our nursing students in their first course in nursing school, they actually have to practice using all of those tools so they can teach a patient. So we have them practice going down steps with crutches. We'll have them practice going down steps or walking in the hall with a cane. We'll have them push each other with a wheelchair because those are skills that they're going to need to do in the hospital. So that's why we practice all of the skills here in our sim lab that the students are going to see in the hospital.
We have a couple more questions. Do you stimulate C-section births?
We don't do C-section births. We don't simulate those because you need an operating room, and we don't actually have an operating room here in our sim lab. Plus, with a simulation of a C-section, nurses don't do much. They take records, they take care of the baby when the baby's born, but nurses, that's beyond the scope of what nurses do to provide a C-section. So instead, what we might do is we would tell the patients that, or the students, that the patient had a C-section, and we would put an incision on her abdomen so they could take care of her while she's laboring to have the baby. And then we would take care of her after she had the baby. But the C-section portion is what they're going to need to see when they're actually at the hospital.
And I think the next question is a little out of the scope of nursing as well, but do the mannequins have, do they have mannequins, excuse me, for surgeons to practice on?
Yes, we do. We also have like arms and skin for doctors to practice. So we have nurse practitioners that kind of work like a doctor, but they're a nurse practitioner. They can practice doing sutures. They can practice cutting into the skin. So we have all of these different kind of simulators and simulated tools that they can practice to become a really proficient nurse practitioner.
And another question is, why do you inject the mannequin on the arm?
So on the arm, so there's certain places that we give injections. We give injections in the arm, in the butt, in the leg. Sometimes we'll give some injections in the stomach. But the reason I did it for that child is because that's the correct place to give injections for that size of a kid. Plus on that arm, there was an injection pad. So when I stuck the needle in, it's not going to hit hard plastic, but hit into an area. It also teaches the students that this is where you should be giving the correct injection for that size of a patient.
Our next question is, can the mannequin throw up?
Yes, the mannequin can throw up. They can make the sounds of vomiting. They can, so the interesting thing about simulation is you're not just mimicking an environment, but you also mimic the sounds and the smells. So in the simulation world, you can actually buy things that smell like poop, like fart sprays or vomit, or all kinds of different things that would, when the students come in, they also smell it. So there's fake vomit and there's fake vomit smell, and then the mannequins will sound like they're vomiting. So in all of those ways, we can make it seem very realistic that the patient is vomiting. Oh, I don't know what I just did. Okay, sorry. That the patient is vomiting, and the students can give the correct meds for that.
One is, does the baby mannequin cry when it is born?
If we hit the button, we can make the crying sound come into the room. So yes, we can also make the baby turn blue. We can make the baby be pink. We can make its heart rate go up and go down. We can make the baby shake like it's having a seizure. So all of these things are built into those mannequins. They're just like mini robots.
Does the mother mannequin nurse the baby?
So she can't actually give milk from her breast to nurse, but the way that she is built anatomically, the students can practice breastfeeding and putting the baby up to the breast. And it's kind of like a puzzle piece. She has the correct breast and the baby's mouth is the correct size. So we can practice different holds on, but she doesn't actually drip milk.
Can you draw blood from the patients?
Yes. So these mannequins, if you were to take their outer layer of skin off, you would see a whole vein system of veins. So the students are able to actually fill veins in these mannequins just like a human, and we can fill those veins with blood. And inside the mannequin, he also has all kinds of bladders. So like a little bag that you can put different fluids in that look like he's peeing or looks like he's bleeding. And so, yes, you can draw blood.
What could happen to someone that accidentally got a hold of a dirty needle?
That's a really great question. So I'm going to take any kind of clinical questions. So we know that there are people get injections, and as soon as that injection or that needle punctures someone's skin, it's considered a dirty needle, meaning any kind of diseases that would be carried in blood, like hepatitis, HIV, even herpes, anything that's carried in your blood, or even COVID, if you were to be stuck with that same needle, you could have a risk of getting those diseases. And that's why nurses are really diligent in making sure that any needle that they puncture someone's skin, goes immediately into a sharps container so that no one else could possibly be exposed to it. So sometimes we have people who use needles and don't make them safe and don't discard them as they should, and they might be out in the community. Please don't touch any needle because you don't know who has used it. You don't know if it's clean or if it's dirty, and you don't know what diseases might be microscopically on there that you can't see with your eyes. So make sure that you let a parent or an adult know that there's a needle so that they can help safely dispose it.
How many mannequins do you have?
We have over 20 mannequins. We have babies, kids, females, males. So we have mannequins that give birth, like I said. So we have, but there are different levels. And then some of our mannequins don't do a whole lot except for let students practice skills on them, and others actually react to those skills. So what do you guys think? What would you guess these mannequins cost? For just one.
You can put your guesses in the chat and we'll see. So we have one class put in 10,000 and then one class just put in 1,000. Anyone else? Oh, and then we had someone say 20,000.
Okay, so actually these mannequins cost about $80,000 for each one. So they cost, like the base model is about 70,000, and these are the mannequins that can do everything. Like the first mannequin I showed you, so they can bleed, cry, sweat, make urine. These mannequins are about $70,000, and then we also pay an extra $10,000 for a warranty. So if they break down, we can get them fixed and back in the beds for the students. So yeah, we have a lot of money invested in these mannequins. So we keep them locked up in our simulation lab, which is like a hospital, but the main entrance is locked, and only the simulation people like Jen and I have the key to it. And students are not allowed to use these mannequins without a faculty member there.
So we've only showcased one of our simulation labs. We have two other rooms that have mannequins and beds. So we have over 20 beds for the students to practice on. We have a room that looks like an apartment, and we use that for community health, where we have a grandma in that room, and it's got a refrigerator, it has a stove, it has a sink, a table. We also have a room that looks like a doctor's office, because doctor's offices looks different than hospital. So we have all these different kind of simulated experiences for the students to practice.
How often do nursing students get to practice to improve their skills with the mannequins?
Depends on what semester they're in. So in the very beginning and the very end, they do a lot. They're in the simulation lab 3 days a week in the beginning, and they do entire simulations every single class in the end. Now in all of that, it's mixed up because a lot of days they're actually in the hospital. So they get to actually physically be with human patients. So they come to the simulation lab in between that. So if, let's say that students need more help with taking care of diabetic patients or different things like that, they'll come to the simulation lab. So it just kind of varies, but by the end of their entire semester here, they probably have, I would say, at least 50 days in the sim lab.
Our next question is, can mannequins get sick?
Yes, they can, in two very unique ways. Let me just take you to the other side, and we'll have Jen be in here, and I'll show you how they can get sick and how the nursing students can take care of them. So let me just swap my camera. So this right here is behind the secret door, okay? And so this is where the faculty go. And I can actually see Jen, my student, taking care of the sick mannequin through this window. Now Jen can't see me, but we can see her. And right here, whatever Jen does to that mannequin, I can make the mannequin more sick. So this computer lets me make the mannequin sick or better. So if Jen does something right, I make the mannequin do better. And if she makes an error, I can make the mannequin be worse. The other thing with that is, so that's kind of how we create our mannequins to be sick. But mannequins can also get sick on their own in the sense that their technology doesn't work appropriately. And in that case, we send them either back to the facility so they can get worked on, or we try to fix them ourselves. But they do glitch out, they do cause us problems, they're kind of ornery sometimes. They'll be working perfectly, and the minute students get in here to work with them, they die on us, as far as technology, not truly die. So yeah, they can get sick in different ways.
And another question is, what is the hardest simulation to learn?
I think every simulation is hard on the students because we gear each simulation to what they're learning. So we normally will lecture in class, and then we bring them into the sim lab, and they have to practice the skills that we've lectured or the disease process. So each semester, students always think that this is the hardest simulation until they get to the very end and they're like, oh, that first simulation was so easy, yet when they were doing it, it was hard. I think some of our hardest simulations are ones that have a lot of moving parts. So when we do deliveries of babies, we have to reset that mannequin. There's blood and fluid and, you know, red fluid and yellow fluid and white fluid, and we have to keep resetting it. So from the behind scene, I think that's one of our harder simulations, but it's not hard in a sense for our students.
They're wondering, is it hard to get into the nursing program?
It is. It's competitive. So our program goes by points. Do you want me to hold that now? Our program goes by points. So you get points for your GPA, as you can imagine. You get points for the GPA in sciences, as well as like English and critical thinking. And then you also get points for your overall GPA. But in addition to having good grades, you also get points for speaking another language, for living in this service region, so it's in Stanislaus County. You also get, and also like 7 other counties that's in this area. You get points if you actually work in the medical field already. So like if you're a CNA or you volunteer. So there's lots of areas that you can get points. And then we admit the top 30 students that have the most points. And to get some more information about how that works, you can look on our website, on the School of Nursing website, and there's all kinds of information, like what courses do we look at, what our average GPA is. There's also an equivalency grid that tells you, like, let's say that you took an AP class in high school, if it counts for us, that'll tell you that. It will also tell you what kind of score you should get on a TEAS, which is an entrance exam. And you'll be able to see if, for instance, let's say that you took an AP statistics in high school, will that count for us? It'll tell you all of that. And then your grades, then everything's just calculated and the top 30 get in. I think we had 300 applicants apply, and then we had admit 30 in the spring and 30 in the fall.
Thank you. We did have one other question come in, but I believe you answered that already. It was about, do the points from high school count or just junior college?
Oh, so yeah, high school can count.
High school, if you take the AP tests, those counts for college credits.
Yeah.
So that's the only thing from your high school that will transfer over.
How long does it take to become a nurse? What are some of the classes one would need to take?
So it depends on how long it takes you to get your prereqs done. Usually it's about a year to a year and a half to get prereqs done. And then you apply to the nursing program, and our nursing program is a 3 years long. And the second part of the question was, what classes do you need to take? There's a lot of prereqs that you need to take, but there's 4 very important science classes you need to take, and 4 very important, it's called the 4 core, which is like your English and critical thinking and stats classes. All of that information is on our School of Nursing website. It's really helpful because it'll show you how to get the most points. So to get into our program, we go by a point system. And you get points for if you live in this area, if you speak another language, if you work in the medical field already or volunteer, like if you help escort patients in a hospital, things like that, you get more points. The higher your GPA or the better your grades are in certain classes, the more points you get. So if you, let's say you took an AP class in high school and you want to know, well, is this going to help me become a nurse? Well, that website will show you exactly what classes help you become a nurse. and count for our classes and how you can get the most amount of points. And so we have about 300 applicants each semester, and we accept 30. So it's the 30 that have the most points, and it's based solely on those points. So our website has all the information you need for that. And to get into the nursing program, I did mention, but also I just want to let you know that nursing is so diverse in the sense that you can be so many different things as a nurse. As a nurse, I've been a med-surg nurse, which means just like taking care of adults. I've worked in many different facilities on many different floors, like surgical floors, cardiac floors. I've worked out in the community. I've worked in mental health nursing. Jen's done all kinds of different things in a doctor's office. She's also worked in a on a obstetrics, labor and delivery floor. Now we're both teachers. So nursing has so many things that you can just grow and move and do. So once you become a nurse, it's not that you're just like, taking care of adults. You can move around and do so many different things with it. So I just want everyone to realize how many opportunities are available in nursing.
Thank you everyone for joining us. We hope you had a great time with this activity and learned quite a bit about how nursing practice and how it goes.
Thank you everyone for coming.
Bye-bye.
Bye.
Thank you so much for watching. Please follow us on social media to find more about our upcoming events.